Welcome students to a brief lecture on how to calculate heart rate and determine interval durations for an ECG. So we're looking at a normal ECG here. We can see all of our waves. So we've got our various waveforms. We've got our P wave representing the atria depolarizing. We've got our QRS representing the ventricles depolarizing. And we've got the T wave there represent the ventricles repolarizing. The atria, of course, will have to repolarize as well, but because they are much smaller than the ventricles, the electrical events of the ventricles depolarizing, represented by the QRS complex, essentially completely overshadows the wave that we would see for the atria repolarizing. So those are our various waveforms. In order to determine an interval duration, we have to just determine the start and stop points for the interval, determine a distance, and then convert that distance into time. So if we were to do a QT interval, for instance, we start with the Q and we go to the end of the T. And so we determine our distance. Remember, one small block is 1 millimeter, and one big block is 5 millimeters. And so for our QT interval here, I have 5, 10, 11. So 5, 10 plus 1, that gets me to 11 millimeters. Well, I also know that 1 millimeter is equal to 0.04 seconds, and so I can then take my distance and convert it to time. 0.04 seconds occurs every 1 millimeter, and so I get a QT interval for this particular heart rate of 0.44 seconds. You could also do a PR interval. You could do how long the QRS takes place. You could do the length of the ST segment. There's lots of different intervals that you can look at. But that is how you do it. You first determine your distance and then convert your distance into time. For our heart rate, we follow kind of a similar process, but instead of looking at just a single heartbeat, right, just one heartbeat, we're going to go and look at the distance between two heartbeats. So I suggest using the R waves because they're the most prominent thing on there, typically on an ECG, but you could theoretically go from the top of the T to the top of the next T. You could go from the Q to the next Q. Doesn't really matter overly much as long as you pick the same waveform. Again, the easiest thing generally to see is the R. And so that's what I always use. I use the R waves. So again, step 1, we get our distance between our beats. So if I were to do from this R wave here to this R wave here, I would have 5, 10, 15, 16, 17. Right, so I got 17 millimeters per beat. Well, I now have a heart rate, but unfortunately my heart rate is in millimeters per beat. That doesn't quite work for us because we want beats per minute. And so step 2, we get the distance to time conversion. So I know 0.04 seconds for 1 millimeter. I again do a little dimensional analysis, a little math, and that gets me to 0.68 seconds per beat. Well, now I have to fix my units because again, I've got a heart rate, 0.68 seconds per beat, but that's not my unit for heart rate. And so I have to invert my fraction. Right. Make sure that I put beats in the numerator. Saying 1 beat occurs every 0.68 seconds is the same thing as saying every 0.68 seconds 1 beat occurs. So these two things are equivalent. Now I have beats in the numerator. Now all I have to do is get rid of my seconds and convert that into minutes, and I get approximately 88 beats per minute. And so that is how I determined heart rate for this particular ECG, for this particular heart rate. So that is how you look at both the intervals and the heart rate. And both of those things are going to tell us something about cardiovascular function. If the interval is too long, a particular interval, then maybe the signal is getting stuck somewhere in the intrinsic conduction system. Or maybe the heart is engorged and the signal is taking a longer time to travel. Or if your heart rate is too high, well, maybe you're just exercising, or maybe you have some sort of cardiovascular abnormality and something's wrong. And so by looking at both the intervals and heart rate, we can use them to help us assess the cardiovascular function of our patients.